Well, hello, good afternoon everyone. My name is Michelle Pilling. I'm the Lay Advisor for Quality and Patient Involvement at Eastlands CCG. I think it's an absolute privilege and an honour to be part of today and to be meeting Kate Granger later on. And compassion is all about, certainly compassion in healthcare is all about putting patients at the heart of everything we do, something I feel very passionate about and the CCG is equally committed to. So it's absolutely fantastic to see so many of you joining us today who understand what we're trying to achieve with this. It's quite inspiring. And I'd like to start by thanking Carol for sharing that story with us. There's an awful lot we can learn about compassion from carers. And whilst, as we heard, caring is very rewarding in many ways, at times it's very, very tough. And the great irony is that for many carers, some of the biggest obstacles they face are created by health professionals who don't see them as experts in the care of the people they're caring for and equal partners in care. So I just wanted to start by saying that today isn't in any way, shape or form about saying that any of you here aren't compassionate or that you don't practice the little things. Today is very much a chance for us all to reflect and hold the mirror up to ourselves and ask ourselves, are there times when the care we provide could be better? Are there more of the small things that we could be doing? And I'm sure there are examples that we can all think of. We've heard some already from our own experiences or the experiences of our friends and family. Episodes where care wasn't so good. One of the stories I heard recently was from an older lady who rang her practice to ask for a GP appointment, to be told that there was about a 2-week waiting list. And the lady, really out of frustration as much as anything, said, well, I might be dead by then. And the receptionist quickly responded, well, you won't need the appointment. Quite shocking, but true. And I think sometimes we can think something like that's just an off-the-cuff remark, but for the patient it really lived with her, and she had an anxious 2-week to see the doctor. So of course, all of us here are very busy. We have lots of pressures on our time, costs, resources, targets, etc. But what patients tell us is it's the small things that really matter to them. The things that don't cost anything, the things that can't be taught, there's no training course in kindness. And I think sometimes it's important that we should keep the patient at the centre of what we do. After all, we'll all be patients at some point or another. And we're going to hear quite movingly later on this afternoon from Kate Granger. And I think that sort of really highlights that illness doesn't discriminate, it can happen to any of us at any time. And I'm sure we've also heard of those reports of less than compassionate care, quite inhumane practice. And it's usually the people who are the most vulnerable in our communities, people who are older, people with learning disabilities, people with dementia, who are often in those reports. So compassion for me is all about empathy, it's not about sympathy. It's about being able to put yourself in someone else's shoes and reflect what would it feel like, you know, to be that person. And compassion can boil down to sometimes lots of small acts of kindness. You know, a simple smile that shows you care, a kind remark to put someone at their ease, or a gentle touch to show empathy and understanding. But what's really important for patients, very often the things that they remember about their experience of care are either the absence or the presence of compassion, so incredibly important. And dementia, a diagnosis of dementia takes place every 4 seconds, which is why it's now more feared than cancer. In the UK, we'll shortly approach the 1 million mark, 1 million people living with dementia, and that's 50 million people worldwide. And I think those stark facts alone sort of indicate why now more than ever we need to tackle the stigma and discrimination around dementia. And that's why the Dementia Friends programme is so important. So the Alzheimer's Dementia Friends project, which you're about to take part in later on this afternoon, will help you to understand a little bit about what it feels to live with dementia, and hopefully from that understanding turn that into action. So in the next session, what you'll do is find out a little bit more about dementia and what it might feel like. Hopefully that'll foster some empathy and understanding, and if enough of us go away and become dementia champions, and we can significantly change the way that people who live with dementia experience services and how society treats them. So, many of the big organisations have already embraced the Dementia Friends, so organisations like Marks and Spencer's, Argos, Lloyds Bank, Lloyds Pharmacy, they're already rolling out the Dementia Friends programme across their organisations. So my challenge is to you is, what are you going to do? Are you prepared to go out and do the same? The number of dementia champions, and I've got my little badge here, there's about 250,000, probably a bit more than that now, and you're about to join that number. So I think that Kate Granger is an absolutely fantastic ambassador for compassion. But we've all got a responsibility to make sure that compassion is hardwired into our own organisations. And as Phil said, really, it's not just about hospitals and care homes. We need compassion everywhere, and particularly when it comes to dementia. So I'm going to introduce you now to Rachel, who's going to be doing the dementia awareness training.